You're with Afternoon Agenda, where we are continuing our coverage of the latest coronavirus outbreak on Sydney's northern beaches, which is throwing travel plans into disarray right around the country. Joining us live now is Dr. Andrew Miller. He's the president of the Australian Medical Association in Western Australia. Andrew, appreciate your time. Just how concerned are you about this outbreak on the northern beaches? How are you expecting it will play out in the coming days?
Thanks, Ash. It's good to be here. I think this is a serious outbreak, but it's going to be business as usual. We need to accept that over the next 12 months or so, we're going to see continued interruptions to travel. One thing that's been, I think, focusing people's minds is that there's 10 or 12,000 people from New South Wales here who need to now have a COVID test in Western Australia and self-isolate till they see the result. That gives people an idea of the number of people moving around the country at the moment, and there will be a lot more than that coming up to Christmas, and that's how the virus gets around. So this is why travel restriction is the most effective way to shut things down while we try to understand the extent of this outbreak, which is going to be a reasonably big one, I think.
Mark McGowan, the WA Premier, has stopped short of reimposing that hard border. Are you suggesting that that was the wrong call?
No, they have a stepwise response, which they've published, and it's quite clear that once you get to more than 5 community cases on a 14-day rolling average, that they will consider that. I suspect that they'll move to that fairly soon. But I think that it's reasonable for them to put some thought into it, put some nuance on it, understand exactly all the information that's coming from New South Wales. And then I think people can understand that it is a fair process. And that's very important, because we're asking people to really take a big hit to their plans, to their very important family reunion and so on. And I guess what we're asking them to do, we want to show them that that process is a very reasonable one. And then I think also look at what's happening in the rest of the world and just, I guess, be grateful for the problems that we do have, whilst appreciating that we need to display a lot of sympathy for those people who are getting caught up in this.
New South Wales today announced that it's closing a loophole which saw international air crews not being policed in quarantine. We've seen some fines today announced as well for some 13 crew members in Sydney who did the wrong thing. Before, as I understand it, the airlines essentially ran their own programs and some crew weren't following the guidelines. From Tuesday, they'll be forced into policed hotel quarantine. Are there any other loopholes you're worried about that need closing? Any other major risks that you think authorities haven't acted upon?
Yeah, well, isn't it amazing that we get to December and things that the people in the street would think were being taken care of, because that's where we know the COVID is, that's where we know it's going to come from. We would think, to avoid all of this disruption to the community, that we would be really on top of this stuff, and we're not yet in Australia. Our hotel quarantine is not rigorous enough, our ventilation in there is not good enough, and we're still arguing about the type of PPE because the government seem to be finding it very hard to accept that we need the sort of PPE you see on the TV in China and Vietnam and in America, where people are wearing the full face respirators and the suits and protecting themselves properly. I think the community have a right to demand answers and say, why are we not just getting people in the community now to be wearing a mask as they go about their business? It's not a big ask. And these are simple steps that we can take to avoid all this terrible disruption to people's plans and businesses.
We keep being told that New South Wales is the gold standard on testing and tracing. How confident are you that authorities there will get on top of this cluster, that we won't see Sydney turn into a Melbourne-style spread of the virus?
Well, I'm not confident at all, because this disease is incredibly infectious, and if people are gathering together, particularly without masks and in indoor stagnant locations, it'll get around the place. And you can have as much testing, tracking and tracing as you like, but what you're doing then is you're just following the outbreak, you're just chasing it down. If we can get people into isolation quickly, then that's great, but I think that they're overconfident in the tracking and tracing in the statements that are being made publicly. I'm sure that the people who are running it are reminding the politicians that, look, this is second best. Best is to keep it out. It's second best to be having to chase this problem and enforcing restrictions on people. So I think that it is a bit of an exaggeration. I think it is a bit dangerous to go out and say that sort of thing when this disease has humbled mighty nations who have equal resources to ours. And let's face it, if the Chinese in Wuhan were unable to bring it to heel when they know largely where each member of their population is, that tells you something about how difficult this is to control with tracking and tracing.
Because if we're honest, Andrew, complacency has been a real problem here in Australia, hasn't it? I mean, you can understand why people at this point would be reluctant to go and get a test at what is often the busiest time of the year for many businesses, not to mention socially, but it does pose a lot of risks.
Well, yes, it certainly does, and this disease doesn't care about our festive season or what it is that we want to do. It simply just needs another host to move into, and that's what it does very, very well as soon as people start to gather together. And we've seen the data on other respiratory illnesses, such as the rhinovirus, parainfluenza, RSV, have all skyrocketed. And in fact, are causing real problems for our hospitals here in Western Australia that can't cope with that degree of respiratory illness with zero COVID. So that means that people are coming close together and transferring these illnesses to one another. So the men that had taken up washing their hands back in March, I suspect have abandoned this strange practice, and for the large part. And people essentially thought this was like a Hollywood movie where we'd been through the difficult bit, we'd had a bit of a drama, the heroes had solved it, and now we're out the other side. But that's not the way that it works, unfortunately. And until the end of next year, which is about the time frame we'd be looking at to get a good vaccine rolled out across the community, we're going to have to accept that this kind of restriction on our ability to travel around the place is really the best tool we've got in Australia.
Dr. Andrew Miller, appreciate you joining us on Afternoon Agenda. Thanks so much.
Great to be here. Thanks, Ash.